Welcome to our Family Talk video supporting student health. I'm your host, Rebecca Downing. I am Senior Director of Communications and Parent Initiatives at Colgate. We're here to talk about the resources that Colgate has in place to support student health and well-being, and the things that parents, family members, or guardians can do to help their student stay healthy and feeling well. Joining me today is Dr. Ellen Larson. She's Director of Student Health Services. Dr. Larson is herself a graduate of Colgate from the class of 1994. She earned her medical degree from Pennsylvania State University College of Medicine, and she's been a family medicine doctor for more than 20 years. She joined Colgate Student Health Services in 2019 and was named its director just this past year. Dr. Larson, thanks for speaking with me today.
Thanks for having me back.
Great. So let's start with, what's the first thing that you want parents and guardians to know about student health services, the staff roles you have in place, and the services that you offer?
I think what I really want parents and families to know is that we actually have a great team here. We have a team of 3 to 4 administrative staff, all of who have years of experience, both in student health, but also in other healthcare settings. We've got a nursing staff who, again, has years of experience prior to coming to student health, and many of whom have been here for years. And they're able to talk to students on the phone and help them assess their symptoms, whether or not they need to be seen or can manage their symptoms on their own. And they're also an active part of the care team in the office. And they lead our STI screening and immunization visits. And so they're an integral part of our team. And we also have a great staff of providers. So in addition to myself, we have a PA who has been part of this team for more than 20 years, probably more than 25 years.
And a PA is?
I'm sorry, physician's assistant. Yes.
Okay, thank you.
And we have an additional physician's assistant and nurse practitioner, both of whom came to us with years of experience in primary care, women's health, ear, nose, and throat care. And so they bring with them lots of experience and lots of knowledge and lots of expertise. In terms of what services we offer, it's Rebecca, you and I were just sort of joking. It's a little bit about what don't we offer. We do a little bit of everything, or just about everything, and certainly are a place for students to start. If a student isn't sure where to go, please, we want them to start here, because we can make sure we get them connected to the right places if they need something beyond what we can offer. So we really do offer everything from preventative care to acute care for sickness and injury, to helping to maintain chronic illnesses, to mental health care, to gender affirming care, to sexual health and wellness. And it's a little bit of everything.
Great.
So
Thanks. So you mentioned illness. Being sick while away from home can be scary for students and for their parents. It's not like a parent can feel their forehead from afar when they say they don't feel well. So it's kind of hard to judge sometimes over the phone how sick a student might be, if they're on the phone call or on FaceTime. Can you share some helpful tips for parents to guide their students from a distance?
It's hard. It is, one of the things we didn't mention is that I too have children in college. So I have a first year in college and a senior in college, and even children who have been raised by physicians struggle with this sometimes. And so I think the first most important thing for everybody is not to panic or assume the worst. It's, common things being common, chances are that what they've got is the same sort of thing they've had when they've been home. And so helping them to understand how you would have handled this at home, and how you navigated illness in the past, and also helping them to have the resources they need to manage that. So thermometers, and every family manages illness a little bit differently. And some of that is personal, some of that is religious, some of that is cultural. And so helping to remind them how you navigated illness when they were home. Do they, would you have routinely given them Tylenol or ibuprofen for a fever or a sore throat? And do they have those things? Would you have routinely used cold medicine or not? Or, were there comfort foods or teas or things like that are how you would have navigated at home, and helping them to have those tools and helping to remind them that that's how you would have handled this at home. And so helping them to develop those skills to be able to navigate that themselves too. But also helping them understand when you would have taken them to the doctor. So a fever that's been around for a couple of days or won't come down, persistent or worsening pain, earache, sore throats, belly pain, that sort of stuff, or worsening coughs. Those are the kinds of things that you probably would have taken them to the doctor for when they were home. And so those are the kinds of things that we definitely would want to hear from them about. And the other thing that we're sort of in our hoping to be post-COVID era, we all know that we're not post-COVID, but in that era where we have evolved, one of the things that we also are hoping that people will start doing is if they're sick, but well enough to go to class, that they mask. And so, yeah, if they really need to get to class, but they're sick, can they put a mask on so that whatever they have, whether it's a cold or the flu or COVID, we're trying to decrease how much of that is being spread and shared, but a lot, making sure that they can still stay engaged in their classes and those things. So
great, that's very helpful. Thanks. It sounds like what you're saying is like return to the familiar, because that's going to help.
Yeah.
So what can students do if they're feeling unwell outside of the hours that Student Health Services is open? So ostensibly nights and weekends. Maybe you could walk us through where they should go for what in terms of the most typical issues that college students tend to come up with.
Yeah, so we actually have some pretty good local resources right here in town. Literally, we share a parking lot here at Student Health with the medical campus in town. We have both an emergency room and an urgent care. The emergency room is available 24/7. The urgent care is open at times where a typical office would not be open. So weeknights, it's typically 5:30 to 9, and then it is open on the weekends. Staffing permitting, like everybody else, they struggle with staffing too. But those resources are available. And so again, urgent care is the kind of stuff that you would go to your typical doctor's office for, but you feel like you can't wait until the next morning or Monday. If there's a very severe sore throat or very, significant symptoms, and you feel like waiting until the next day is not a good idea, then that's when we would encourage students to seek urgent care. The emergency room is really for emergencies. And so again, I'm thinking about when you might have accessed an emergency room at home. And the things I think about are, and that we think about with students, are severe headaches that just won't go away, and that aren't getting better with medicine. Fevers. I have a high threshold for fever. So my usual answer is a fever over 103 that won't go away an hour after appropriate medicine, right? Like if you can't get a fever down, then maybe they should really be checked out. Difficulty breathing, an obviously broken bone, or a sprain that's so bad that they can't use, whatever limb is injured, whether they can't walk on it or any of those sorts of things. Or again, the other common thing is abdominal pain. Abdominal pain that's severe enough that they can't navigate it at home or in their dorm or residential setting. Those are the kinds of things where we would think about an emergency room and really seeking that level of care. The one thing we would ask or encourage is that if students are seen at the ER or urgent care, that they mention that they are a Colgate student, because that helps us to get their information back. And so that then if they need follow-up, it helps to keep us informed. We don't always get that information back if they aren't asked and they don't mention that they're a Colgate student. So that's really helpful.
Okay. How can parents best support their students themselves if they are sick or struggling with wellness issues? And then what advice can they give their students about what to do if they are sick while they're here at college?
I think one of the things that I really want students and families to know is it's okay to miss class for a day or two because they're sick. If you're sick enough that you wouldn't have gone to school or you wouldn't go to work, it's okay to call out for a day. And students can message their professors and say, look, I'm sick, I can't come today. And then work with the professors on the work that they have missed. Professors are actually not to require letters for a day or two of absence like that. If a student is going to be out for several weeks because of an injury, a surgery, something like that, then we will work with the deans to communicate with professors. But if it's a day or two because a student is sick, they have strep throat, they've got the flu, they've got COVID, then really just stay home. It's okay to stay home for a day or two and rest. I think we've all learned in the last 2 years that we all probably need to do a better job of that, and taking care of ourselves. And we actually see a lot during flu season, students that just, they need to come in because they need to have a flu test so that they don't have to go to class. And they don't need that. They can just simply say, I'm sick, and communicate with their professors about that. I think, for me, I think the thing I wish that most students and families would embrace the importance of is sleeping, eating well, and finding connection. I think in terms of overall health and wellness, sleep is critical. And I think it's the age, I think it's the college culture. There's something, about pulling the all-nighter that has this badge of honor to it, but it's actually not, it's really not good for people. And it's really important to overall health and well-being, that there's good sleep and that people are working on good nutrition, and those sorts of things. And I think if students are having trouble finding that balance, and one of the things I hear a lot at this time of year, especially, is students that are having a hard time finding connection sometimes, hard time making friends, trying to find their people, trying to find that balance between the academic load and being with friends and those sorts of things. They're not alone. They're absolutely not alone. And actually the counseling center and the wellness center are built to help them with those things. The Shaw Wellness Center has peer coaches who are students that are upper class students that are trained to actually help coach students through a lot of these common things. And then of course the counseling center is available. So, just reminding them to be healthy and to eat and to sleep and to find time to connect with others. And then if they're struggling finding those balances, remind them that there are places that they can get help and support in that.
Do you refer students directly to those other entities on campus, or
Yeah.
do you work directly with them?
Yeah, we absolutely do. And so, and I think the one thing that often doesn't get mentioned is there is a dietitian too through Shaw Wellness, who is actually part of the wellness team, and will work with students. There are a lot of students when they come to campus who struggle, particularly if they have special dietary needs, or again, I hear from a lot of vegetarian students that it takes them a little while to find the foods. That dietitian will actually go to the dining hall with students and walk through the dining hall with them and help them find foods that are healthy, that help them find a balanced diet, and help them find foods that they enjoy that meet their needs, and those sorts of things. She's a wonderful support. So, and a lot of people don't realize that she's here and accessible. So
great. Thanks for mentioning that. Yeah.
Yeah.
So from illness to injury, what happens if a student is hurt, and they're injured on this campus? Can you talk about what services there are in place to assist students who have an injury?
Yeah, so obviously we want them to get seen, and make sure that we know that the injury is what they think it is and whether or not they need other supports. And so we're here and can see students and order imaging if necessary and that sort of stuff. And as we talked about just a minute ago, the urgent care and the ERs are available if it's after hours, or if it's a significant enough injury that, again, an obviously broken bone should probably just go right to the emergency room and that sort of thing. But so those are the resources there. In terms of once someone has been diagnosed with an injury, if they need physical therapy, there are 2 resources for physical therapy within almost within the campus limits. One is the hospital right here, immediately adjacent to the student health center. The other is the orthopedic office, which is just beyond the football field here in town. The other thing that I am finding that a lot of students don't realize is that there are 2 pharmacies in town that are accessible in terms of if we need to send somebody for a splint or an ACE wrap or those sorts of things. Sometimes we can provide that, sometimes we can't, and we need to send them. And again, for those, the ice packs and the Tylenol and the ibuprofen and those sorts of things, those resources are available. The other thing that comes up fairly often is students with injuries that make it hard to navigate campus. It is, and everything is a hill, we know that. And so,
Building stairs.
yes, getting up and down that hill with a sprained ankle or a sprained knee or a broken leg, or even with a bad case of asthma, can actually be really challenging. And so we currently have a system in place through the graciousness of Campus Safety for a program that's called Ride Assist. In order to access Ride Assist, a student has to work with either someone at Student Health Services, an athlete can work with an athletic trainer. I believe the deans may also be able to help students access Ride Assist. And what that is for that time frame that a student needs it for an injury or something like that, by being on that program, it allows them to call Campus Safety and ask for a ride. The advantage is that Campus Safety can practically drop them at the door of where they need to be.
That would be like to class or back to their residence hall, to dining. Is that sort of the scope of it?
Yes, it's considered anything on campus is primarily, so they will get them to student health, they will get them to class, they will get them to the dining halls, they can get them to the library. If they were to have an appointment at, like, you know, with us or at Community Memorial Hospital, which is right here practically on campus, or like we mentioned, that orthopedic office that is essentially on campus, they can help them get to those appointments too. They're not able to take them out of town. It's just not realistic or feasible to ask that our Campus Safety staff can be transporting students all over, which is so there is that limitation. I know a lot of people are worried about how long they might have to wait for a ride. Campus Safety always encourages them to call 15 minutes before they need it. But the last time we were quoted a response time, I believe it was 3 minutes in terms of from when the students call to ask for the ride to when they show up, that was the average. So while they ask students to give them 15 minutes because they don't want a student to be late for class because you know, they may be tied up doing something else in the moment when a student calls. The response times are really very good, and they literally can get students to a door, where if anybody has experienced parking on this campus, if a student was trying to drive themselves up the hill, or it's really difficult. So Ride Assist is actually very nice in their ability to get students to where they need to be.
And they get approval for that.
Yes. Yep. And they are asked to sign a contract that says that they understand that, you know, it's there.
What the parameters are.
Yeah. If they call, they're supposed to be there when Campus Safety gets there to pick them up. They, you know, can't bring 4 friends along with them in the Campus Safety vehicle and those sorts of things. They have to behave.
Okay.
But
yeah. So let's shift to prevention. Something that parents ask a lot about is, can students get vaccinated on campus, whether it's for flu or upcoming COVID, new boosters, anything like that? What can you talk about in terms of what's available and your advice on college students getting vaccinated?
Yeah, well, and of course, obviously, we're fans of vaccination, and so we would support that, obviously. So Student Health Services is actually able to offer pretty much any typical vaccine a student would need, whether that be for routine preventative health care or whether that be for travel health. Yellow fever is the only vaccine that we cannot administer because that can only be administered by certified travel health clinics. Short of that, we actually have the ability to offer every vaccine. Sometimes the hindrance in that is we don't bill insurances, and so there can be a charge. If students have the Colgate health insurance, that Colgate sponsored plan, those students can receive any immunization here at the health center for free. So that is a unique situation. We do not bill any other insurance though. So anything else we did, we would have to charge students for, and then they can bill their insurance and get reimbursed. But I mean, the things that we hear about most are COVID and flu. We will be working towards bringing local pharmacies onto campus this year to provide COVID and flu vaccines for students. I believe the email is going to go out in the next day or two. And in early October, there should be COVID and flu vaccine clinics available to students on campus through the local pharmacies. The trick in that I am going to say is that the students need to watch their emails, and if they're interested, as soon as they get it, they need to sign up, because spaces are limited and they fill up quickly. But I would also ask that if a student does sign up and then can't make it, that they cancel that appointment, because we do see often that opportunities are lost because somebody signs up and then they can't make it and nobody knows, and then that space goes unused and that vaccine goes unused. So that would be my only, my two pieces of advice there is, as soon as they see the email, if they're interested, sign up, and if it turns out that they can't make it, ask them to actually cancel so that space opens for someone else.
Right.
So.
And of course, in addition to the clinics offered on campus, you mentioned earlier, there are 2 pharmacies in town, both on the cruiser route.
Yep.
And students can make appointments to get vaccines there as well, right?
They can. They absolutely can. They don't have to wait for us to do them here on campus. You know, those appointments are easily booked online. They don't even have to call. They can just do it online. And they offer them all varieties of times of day, including some evening hours, because their business hours are available for that. So yes, that's always an option. It's always available.
Okay, great. So shifting gears a little bit, can you talk a bit about, you know, college students are emerging adults, right? So they're still their parents' children, but I think it's important to talk about confidentiality and how that works for college students, and why it's an important part of your practices at Student Health Services and how you carry that out.
Yeah. So I think everybody knows that at every physician's office that they go to, every medical office that they go to, the rule is confidentiality. Information isn't shared without permission. And this is a hard stage of life because parents are used to having access to their children's health care and their information, and kids are often used to having their parents navigate that. And so there is a little bit of an awkward transition. But something that we really work to strive here is making sure that students know they have a safe place to come and ask questions about anything and everything. We see and hear from students, even the students with the most supportive family and families that want to support them in the most ways, students fear disappointing their families. They fear letting people down. And whether it's because they're feeling overwhelmed with academics, or maybe they're wrestling with a little bit of depression or anxiety, or difficulty making friends, or drug or alcohol use, or sexual health concerns, or any of those things, we really just want to make sure that students know they have a safe place to come where they can put those fears aside and know that we can talk about anything and everything. And so in order to make sure that they know that that is the safe place, we do build that structure that can sometimes be frustrating for parents, that this is their private information. And unless a student specifically says that we can talk to parents about this topic, we often won't. And so that can cause a frustration. We'll work with students for how to talk to their parents about it. We'll work with students to, often we can find a way to share at least some information or communicate, and sometimes we don't. If we are concerned that a student is imminent danger and we think that parent or family support is needed, we will reach out to them. Sometimes we actually need to empower students to make care decisions for themselves, and we'll encourage them to contact their families. But if we know that they're safe, we may not be in a position to really require them or to divulge that information. That sometimes that is part of this journey for students, that they need to know that they are empowered themselves to care for themselves, seek care for themselves. And it helps them to build the confidence to do that moving forward in a way that's really important for their well-being and their health. So did that answer the question?
I think it's very much so. Thank you.
Yeah.
Before we go, we've covered a lot, but is there anything else that I didn't ask you about specifically that you want to be sure that families know?
I can't think of anything that you didn't ask specifically about. I think the thing that we really want students and families to know is that we're here to support students. If they have a concern, we want them to call us. We really want to talk to them. And that's what we're here to do. We're here to help them. We're here to support them. We're here to, teach them about their health and well-being, and to help them learn how to navigate what can sometimes be a challenging healthcare system. And really just, we want to talk to them. So if they have questions or concerns, maybe just have them call us.
Fantastic. Dr. Larson, thank you so much for sharing all this knowledge with us. I really appreciate you joining us today.
Thank you.
For today's edition.